Hey everyone, if you're tuning in, you're probably already familiar with medical coding, maybe even up to your eyeballs in textbooks and practice exams.
Yeah, it can feel pretty overwhelming trying to master all those codes and guidelines.
It's definitely a marathon, not a sprint.
Oh, what if we told you there's a way to make it easier? Like really boost your learning and get those tricky concepts clarified.
All without spending a dime.
Exactly.
That's right. We're diving into this awesome opportunity specifically for those of you already on the medical coding path.
A free 16-week YouTube course offered by the Absolute Medical Coding Institute, AMCI.
AMCI. Now, before we get too excited, I want to be clear about who this is really for.
Yeah, this isn't for brand new coders.
Right. If you're a current medical coding student, though, whether you're self-studying or part of a formal program and you're looking for extra guidance, well, this is for you.
But if you're just starting out with medical coding, we highly recommend AMCI's introductory course.
The I2MC.
Yes, that'll give you a solid foundation.
We'll make sure to include a link in the description for that.
Absolutely. This 16-week deep dive is all about taking your existing coding knowledge to that next level.
Focusing on the advanced guidelines and concepts that can really make a difference.
In your understanding and ultimately your success.
Okay, so let's get into the details.
What can you expect?
Well, this free coding intensive kicks off March 10th, 2025.
And runs until June 23rd.
Streaming live on YouTube every week.
7 p.m. Eastern Time.
And the best part,
Totally free.
totally free. And you even get a certificate of completion.
Add that to your resume.
Shows your commitment to professional development.
Now, it's important to mention this doesn't give you the 80 credit hours needed for AAPC apprentice status removal.
Right.
But think of it as a powerful tool to sharpen those skills.
Yeah, solidify that coding knowledge before you jump into official exam prep.
Exactly.
It's like you're building a strong foundation for your coding career.
The course really gets into the details of ICD-10-CM and CPT coding,
Helping you navigate those tricky guidelines and apply them in real-world scenarios.
which is where it really matters, right?
Oh, absolutely. Accurate coding isn't just about passing an exam.
It's about ensuring proper reimbursement for healthcare providers
Maintaining data integrity for public health tracking.
and ultimately contributing to the efficient and ethical delivery of healthcare.
Okay, so let's break down what you'll learn over these 16 weeks.
The first 8 weeks are all about mastering advanced ICD-10-CM guidelines.
Advanced, so we're going beyond the basics here.
Yes, you'll dive into the intricacies of sequencing guidelines.
Those special notes in the coding manuals that are easy to miss.
How to code for all sorts of body systems and conditions.
You know, I remember really struggling with sequencing guidelines when I first started out.
Figuring out which condition to code first can be tricky, especially when a patient has multiple diagnoses.
Like solving a puzzle. But the pieces directly impact patient care and reimbursement.
You got it. That's why this deep dive into ICD-10-CM is so important.
It's not just about memorizing codes. It's about understanding the logic behind them.
The why.
Exactly.
And to help you really get those guidelines down, the course introduces a unique learning technique called the TAP technique.
TAP technique.
It's all about actively engaging with the material, not just passively reading.
Oh, I like that. So what does that look like?
Think of it as annotating and interacting with the ICD-10-CM coding manual. You'll be tabbing important guideline pages.
Annotating for better understanding.
And then literally tapping the code in the tabular list. It's hands-on.
I love that. Turning those abstract coding concepts into something tangible, actionable.
Bridging the gap between theory and practice. You see how the guidelines translate into real coding decisions?
Okay, so we've got the TAP technique for ICD-10-CM. What about the second half of the course?
Weeks 9 through 16 shift focus to CPT coding.
Those procedural codes.
That describe what services were provided during a patient encounter.
So we're talking E&M, coding surgery guidelines, anesthesia radiology.
You got it. E&M coding, for example, determines how we bill for different types of visits.
Like a quick checkup versus a complex consultation.
Yeah, it's a critical area for coders in any setting.
It's fascinating how these codes capture the complexity of patient care, translating those services into standardized billing units.
And don't forget HCPCS Level II and Modifiers, often pronounced HCPCS.
HCPCS, okay.
These are essential for accurately coding everything from durable medical equipment to ambulance services.
And specific circumstances that require more clarification.
Right.
Hold on, you mentioned a Chung technique in week 14. How do you even pronounce that?
CHUM technique, pronounced without the G. It's another active learning strategy similar to the TAP technique.
But for CPT coding.
You'll be circling key elements in the CPT manual, highlighting important details, underlining crucial information, and adding your own notes.
So it's like a structured way to break down those CPT codes and really get the nuances.
Precisely. Engaging with the material, making connections, and developing a deeper understanding of how those codes translate into real-world medical billing.
It sounds like AMCI really emphasizes active learning, making sure students truly grasp these coding systems.
Absolutely. It's not about just memorizing codes. It's about understanding the logic, the nuances of the guidelines, and how to apply that knowledge in real-world scenarios.
All right, so we've got TAP technique for ICD 10CM and Chung technique for CPT. I like it. Pretty catchy. What else can students expect in those final weeks?
Well, week 15 focuses on test-taking strategies, which are so important for those certification exams.
Oh, absolutely. It's not enough to know the material, you need to know how to apply it under pressure.
Manage your time and approach those multiple-choice questions strategically.
I can tell you from experience, test anxiety can really throw you off.
Even when you've studied hard,
Yeah.
having solid test-taking strategies makes all the difference.
So it's about going beyond just memorizing and equipping students with the tools to apply that knowledge effectively.
Exactly. Approaching those exams with confidence, knowing how to break down the questions, identify key information, and make informed choices even under pressure.
And then in week 16, it's all about putting that knowledge to the test. Mock exams.
It's like a dress rehearsal for the real deal. You get to practice your skills, identify weak areas, and get comfortable with the exam format. It's a great way to see where you're at, how you compare to other students, and figure out where you might need some extra review.
So we've covered a lot, but it's clear this course offers an amazing opportunity to refine those skills and deepen your understanding. And did I mention it's free?
Completely free. It really shows AMCI's commitment to making quality medical coding education accessible to everyone.
And here's the best part. The more people who sign up for this free course, the more resources AMCI can dedicate to developing even more free educational programs.
It's a win-win.
It is. So if you're a current medical coding student, whether you're self-studying or already in a program and you're looking for extra guidance, this course is for you.
But if you're new to medical coding, we encourage you to check out AMCI's Introductory I2MC course.
We'll put a link to that in the episode description.
Now, before we move on, think about how this free 16-week course could help you.
Are there any areas of coding that you struggle with?
Do you need help with test-taking strategies?
Or are you just looking for a structured learning experience?
Whatever your goals, this course is a valuable resource that you don't want to miss.
Absolutely. So head over to the AMCI YouTube channel. The link is in the description.
Hit that subscribe button and click the notification bell so you don't miss the launch on March 10th.
We want to make sure as many aspiring coders as possible can benefit from this fantastic opportunity.